I'm Dr. Rachel Chastanay, and I'd like to talk to you today about an analogy that will help us understand why the use of the low carbohydrate diet can help prevent diabetes type 2, as well as progression from pre-diabetes to diabetes, or from diabetes that's in the early stages to insulin-dependent diabetes. So this is what I call the horse analogy. This wagon here represents your body weight, but this is your body weight in your youth. Most of us start out with a fairly healthy body weight at that point in time. These horses here, those represent the beta cells. They live in your pancreas and they make your insulin. These hills here, these represent high carbohydrate meals. These horses are right now on the flat ground, and this represents the fasting state. So in this analogy, horsepower is insulin. So we need horsepower to get up the hills, and preferably without slowing down. Slowing down would represent having your blood sugar rise. So horsepower gets us over the hills. Insulin helps us take in carbohydrates. Interestingly enough, we do not need any insulin to take in proteins or fats. So life goes on, and a lot of times our wagon weight gets a little bit heavier. And sometimes we have some genetic handicaps. Maybe I've got some insulin resistance. So maybe my tires are just a skosh flat here, okay? And maybe my horses are not quite as strong or as long-lived as some other people's. Let's say that I've got a family history of diabetes, and that might tell me that maybe my horses are the kind that are like thoroughbred racers. They come out of the paddock quickly in the beginning. They can put out a lot of horsepower, a lot of insulin, but they kind of poop out a little bit earlier. They don't live as long as, like, you know, a sturdy pack horse kind of thing. So maybe I've got maybe not the strongest or best or longest lived horses to begin with. And then I age, and my horses are under the continual stress as I age of hauling that wagon up these hills. And so between my not great genetics, maybe my horses are not so great to begin with, and then I age, and then my horses are under a lot of stress, and this represents pre-diabetes. Pre-diabetes is often when I'm only slowing a little bit here on the flat ground, or maybe not even at all, but I'm starting to slow when I try and climb these hills. And anybody who's ever seen a heavily weighted 18-wheeler truck or tried to climb a hill with a bicycle knows it makes a difference if there's a hill or not. So when we see a fasting sugar that's not too abnormal, that's because the fasting sugar is checking the speed of my wagon between there and there on the flat ground. Whereas an A1C, or if I were to do some of those glucose challenge type tests, the A1C, hemoglobin A1C, it's like it's checking my average speed of the wagon between here and Cincinnati. So this is a 2 to 3 month average of my blood sugars. So if I am slowing on the hills, i.e. getting high blood sugar on the hills, I'm going to see this in my hemoglobin A1C before I'm going to see it fasting. So this state of pre-diabetes, I've actually got enough horses, but I don't have as many as I started with, and they are not able to haul that wagon up these hills without slowing. So let's say that I've been to my doctor and I find out that I have this pre-diabetic state, okay? So I can look in the mirror and see that my wagon is too big, and my doctor can look at me and see that my wagon is too big. So we both get distracted by the wagon, and we go, lighten your wagon, lighten your wagon, lighten your wagon, lose weight, lose weight, lose weight. Okay, so we try to lose weight, and we lose a little bit, but it turns out that most of us are not able to lose enough. Most of us can't get back down to prepubertal size, okay, in order to lose enough so that my speed is significantly impacted. So my A1C doesn't get a lot better from just a little bit of weight loss. I usually have to lose at least 20 pounds before I can start to see a meaningful impact on my hemoglobin A1C. But we've forgotten, we don't just have one problem. I don't just have a wagon problem. I have 3 problems. I have a wagon problem, a horse problem, and a hill problem. Now let's talk about my horse problem. I can't fix my horse problem. I cannot get a different set of genes. I don't get to go back and get different grandparents. I cannot get better horses. I also don't get to be 20 again. So I cannot go back in time. I can't regrow a dead horse. So I cannot fix this, but I can take very, very good care of the horses that I've got, and I can prevent or slow the progression to diabetes and insulin-dependent diabetes. So I want to take very good care of these horses, and the earlier I start, then the better I'm going to do, because the fewer horses I have, the more stress is on the remaining horses. So if I've got 80% of my horses, I can do a pretty good job. When I get down to 50, which represents full-blown diabetes, it's much harder for my horses to accomplish the same thing. And every time I lose another horse, the stress on the remaining horses is higher and higher as I get lower and lower in my horses. Okay, so I want to take very good care of these horses, so I want to de-stress them. In order to de-stress my horses, I have 2 options. Lighten my wagon, we've been trying that, or get rid of the hill. So in retrospect, once we see the illustration, it seems so obvious. I can stop eating so many carbohydrates. So let's say that I switch that breakfast of orange juice and cold cereal, or maybe a Danish and coffee, and let's say I switch that to eggs, cheese, and sausage. That doesn't sound like a healthy switch based on what we've been taught for the past couple of decades, but in many ways it is, because what did I get rid of? Carbohydrates. I have no hill. I didn't skip breakfast. I'm not hungry. I had what my body needed. I had plenty of protein and fat, but protein and fat do not require insulin to be taken into my body. I don't need any horsepower or almost no horsepower to go on this flat ground here. And so my horses, they're like instantaneously de-stressed. They prick up their little ears and they go, wait, we're not dead yet. Don't unhook us. We're just really tired. And then they start to recover some. You could also think of it as when I am overweight, not only do I have a larger body mass, a heavier wagon, but I also sometimes have fat that grows into my liver and my pancreas. And when I have fat in my liver, it kind of gives me a little bit of a hill all the time. It's putting out more sugar and breaking down more sugar. It's almost like, my wagon is mired in mud, okay? And when I have fat in my pancreas, it keeps my pancreas from working as well, so my beta cells don't make insulin as well. And that's like my horses are stuck in mud. So I do want to lose weight, but here's the wonderful thing. If I concentrate on that hill, okay, then my body doesn't have to work so hard. It doesn't have to put out as much insulin. It's a little bit like my horses don't need as much food and water brought along on the journey in this heavy wagon. And my wagon starts to get smaller as well. So if I work on my hill, then my wagon is going to improve as well. And as I weigh less and less and gain health, then a lot of this mud is going to resolve as well, and my horses will be able to pull better and my wagon will be able to roll better. Now what happens if I keep just trying and trying and trying to lighten my wagon, and I don't address the hills, okay? So my horses continue to die at a faster rate than they need to, and I progress from pre-diabetes to diabetes. At some point in time in late pre-diabetes or early diabetes, most people will see the doctor and they will get put on some medicines. Now, many of these medicines are good in many ways. They're sort of like giving my horses horsey vitamins. So they can help my blood sugars run lower. They can decrease some of the feeling of mud here, help my horses get a little bit of speed up, okay? So that all sounds very good, but they really haven't been shown to prolong the process of losing horses substantially. So unfortunately, if I don't address the source of the problem, then my horses continue to die off. And so I progress from horse vitamins, and then at some point in time, I issue the driver of this wagon a whip, and I progress onto medicines that try to get the last little bit of insulin out of those beta cells. It's almost like beating my horses. Now, to me, that doesn't sound like it's very good for the horses, but we don't have a lot of data that proves that it's bad for the horses, but it certainly doesn't help them or prevent their deaths. And at some point in time, I get so few horses that my wagon is just not going to go at all without rental horses. Now, the problem with rental horses, you would think, well, why don't I rent horses earlier, and that would help de-stress my horses, okay? That sounds really good, but these horses that we would rent, Insulin, they're kind of like, special thoroughbreds. I have to bring a lot of extra food and water for them. They're kind of picky and delicate, okay? So insulin causes weight gain, sometimes a lot of weight gain, but it almost always causes some weight gain. It's a growth hormone. So that's one of the problems. The other problem with either the medicines that are trying to get the last little bit of insulin out of the beta cells or with the rental horses, Insulin, is that neither of those mechanisms is as smart as the horses I was born with. So there's always the possibility that they'll keep running and I'll end up with a low blood sugar. So if they get used to, if I'm dosing and treating for a high blood sugar and I suddenly skip a meal or I exercise a lot, because exercise is a little like getting out of my wagon and helping push it up the hill. I kind of pull sugar out of my veins. So that's a good thing unless it causes me to get a low. And if I get hypoglycemic, well, that feels very bad and scary because it is. And so I'm going to instinctively shove as much sugar in my mouth as I can. And unfortunately, that's kind of a, defeating event. So my little horse here, these guys here, sometimes, they keep running long enough to get me hypoglycemic, but then they're long gone by the time my horse is trying to climb this. So it doesn't really help protect my horse very much in the long run to inject rental horses earlier than they're needed. So it's sometimes done to inject insulin a little bit earlier, but it doesn't really address the source of the problem. The problem is the hills, and unfortunately, if I don't address the source of the problem, eventually I get so few horses that there's just no chance at all of me staying off insulin. So that's why it is so important that we decrease the carbohydrates in our diet while we still have early diabetes or pre-diabetes and still have plenty of horses. Thank you for listening to this talk today. Hopefully that helps explain a little bit about why I am such a strong believer in a low carbohydrate diet, particularly for people who are prone to diabetes.